Welcome, everyone. Thank you so much for joining us today. My name is Aidan Dowling, and my pronouns are he, him. I am the co-founder and chief advancement officer here at Point of Pride. We are excited to have you with us for this special conversation, which is part of our Transgender Awareness Week programming. So happy Trans Awareness Week, everyone. This week is all about uplifting trans voices, fostering understanding, and advocating for greater visibility and access to care for transgender and non-binary individuals. We're grateful to have everyone here as part of this important dialogue. Before we begin, I do want to put out a disclaimer that the information shared today is provided for educational and informational purposes only, and it is not intended as medical advice. Please always consult a qualified healthcare provider for personalized medical guidance. I'd also like to take a minute to introduce those who may not know who or what Point of Pride is and what we do. So Point of Pride was founded in 2016. We are a trans-led nonprofit organization dedicated to providing life-saving, gender-affirming support to transgender and non-binary individuals around the world. We offer direct services through programs such as our free chest binder and GAF program, our HRT Access Fund, our electrolysis support fund, and our currently open for applications annual surgery fund. Our mission is to eliminate financial and systemic barriers to care, ensuring that every trans person has access to the services they need to live authentically and thrive. So I'd like to first introduce our host for today's virtual workshop. So everyone say hi to our host, Laeth Stevenson, pronoun she, her. Laeth is an artist, legal professional, and advocate for trans rights. She attended Emory University, where she received her BA in political science and began her professional career. At Emory, Laeth served as fellow for both the Ethics and Servant Leadership Program, as well as the Scholarly Inquiry and Research Program. She is currently applying to graduate programs in public policy. Laeth continues to reside in Atlanta, Georgia, where she works in litigation with an employment discrimination practice. In her free time, Laeth volunteers with the Transformations Project, a small grassroots-based organization that tracks anti-trans legislation and serves on the board of CARP, the Center for Abolition Research Policy and Education, which is also an Atlanta-based nonprofit committed to the advocacy of policy, research, and education benefiting Black, queer, and trans communities. Laeth was also a 2024 recipient of our Point of Pride Annual Surgery Fund, allowing her to have access to her own facial feminization procedure back in July of just this year. She enjoys dancing, cooking for loved ones, making funky cocktails, and being in community with other queers. Welcome, Laeth. Thanks so much for joining us.
Thank you so much for that. When I wrote that, I didn't realize how much I wrote, so I appreciate the warm welcome.
It's beautiful. We love it. We love to get to know you. And I know that everyone will be even getting to know you even more as the next hour continues. Awesome. So next up, please welcome our guest, Dr. Speigel, pronouns he, him. Dr. Jeffrey Speigel is an innovative and accomplished double board certified plastic surgeon known for pioneering some of the most advanced techniques in facial surgery. His insights into facial appearance have impacted surgeons worldwide and resulted in newer and more effective procedures detailed in over 100 publications. Dr. Speigel is renowned for his expertise in facial surgery, specializing in facelift, rhinoplasty, and Dr. Speigel, you're going to have to help me out with this one. Blepharoplasty?
Perfect. Blepharoplasty.
Oh my gosh. Wow, that's a first. Blepharoplasty surgeries. His approach is highly personalized, aimed to achieve the best possible aesthetic outcome for every patient. Dr. Speigel has practiced for over 20 years and performs over 1,200 surgeries each year. Oh my gosh, that's a lot of work. Dr. Speigel is credited with pioneering safe combinations of rhinoplasty with lip lifts to enhance facial harmony and aesthetics. Dr. Speigel is regarded as an industry expert in complex revision surgeries, and he is recognized by his peers for his insight, skills, and natural results. Thank you so much, Dr. Speigel, for being here today.
Oh, thank you so much for the invitation. I very much look forward to answering questions and sharing whatever information I can.
Awesome. I love it. So before we begin our fireside chat, I want to remind everyone that we will have time for questions at the end of this discussion. So please feel free to ask them into the chat or the Q&A box at any time. I will also be dropping any links that Dr. Speigel or Laith may be mentioning, and I'll also make sure to put in a link to our application for the annual trans surgery, which is currently open. I'm going to stop talking and I'm going to hand it over to you, Laith. Thanks so much.
Thanks again, Aiden. Hi, everyone. Happy Transgender Awareness Week. Welcome to today's Fireside Chat. This Fireside Chat is going to focus on facial feminization surgery, a gender-affirming surgical procedure designed to soften and reshape facial features typically associated with masculinity, creating a more traditionally feminine appearance. FFS is a crucial step for many transgender women, non-binary individuals, and gender-diverse people in aligning their physical appearance with their gender identity. Procedures can include brow bone reduction, rhinoplasty, lip lift, jaw and chin contouring, and hairline advancement. For many people, these changes significantly reduce gender dysphoria, increase self-confidence, and improve quality of life. Please join me in welcoming Dr. Speigel. Hi. So I'm just going to jump right in to some questions.
Absolutely.
So I guess I'm wondering what first inspired you to specialize in gender affirming surgeries, and particularly facial feminization surgery?
Okay, well, that's a great question. When I started doing facial feminization surgery, there wasn't a field in this. It wasn't a thing. There was one other doctor, now long since retired, in San Francisco, who was doing some of this. And it was not on anybody's radar, not in anybody's training programs, not in anybody's practice. It was just fully unknown. So I trained in head and neck surgery, facial plastic and reconstructive surgery, microsurgery, and cranial surgery, so adjusting skull bones. And then I went into practice at Boston University here in Boston, Massachusetts, and was seeing people who needed assistance in those areas. And then one day, very early on in my career, a transgender woman came to see me, and she said, "I would like to look more feminine. Can you help me?" And I thought to myself, well, I know how to do surgery, but what would we do? Like, what does one do here? So I looked in the literature. That's what doctors do. They go to the medical literature, all the publications that people have had. And essentially, there was nothing on this. So I spoke to this woman. I said, well, here are things that I see that are perhaps causing you to look more masculine than feminine right now. And here are ways we can change them safely. And this is what it would look like. But this is all very new. And I expect her to say, thank you very much, goodbye. But she said, great, let's do it. I said, oh, really? Okay. So we did the surgery, and she was very, very happy and really looked wonderful. And I thought, well, that was a very interesting and unique experience, one that I am unlikely to encounter again. But she told someone who told someone who told someone, and before you knew it, a lot of people were coming to see me for this. Now, I'll try to make the story shorter. This was very fortuitous for me because it put together all sorts of things that were important to me. Number one, the people who were seeing me for these kinds of procedures, it was very significant. It wasn't, I feel like I'm looking older. Can you make me look a little bit younger? Which is important. And I don't mean to minimize that. I do a lot of that. But it was very fundamental. I felt like I was really helping people on a deep level. It was complex surgery. It involved all the areas of surgery that I was trained in. And then the people I was meeting were so nice. And then finally, it was fully unknown. So I'm a professor, and this is an area that I could now think about, right? Like I think about, well, what makes a face feminine? What makes a face masculine? How do you know someone's gender when you look at their face? How do you do that? no one was studying this at the time. And so it all came together at that moment.
Wow, that's
Sorry for the
really
long answer.
no, don't apologize. I appreciate the thoroughness, and it's good hearing your story. Um, I guess with it being such a innovative field, I'm wondering what is your biggest challenge that you've faced so far, being a surgeon in the field, and how have you overcome it?
My biggest challenge. Well, there's been a few over the years. I mean, I think challenge number one was figuring all this out. I mean, I'm proud to say that many of the procedures done around the world now are ones that we innovated. The way people adjust the forehead, the way people adjust the lip, the way people adjust the nose, the way people adjust the jaw. Certainly the state of the art or the standard operation for your larynx, for the Adam's apple. These are all procedures that we developed. I'm very proud of that. And coming up with safe ways to do that was very important. Then making sure it was helpful. You know, one of the hallmarks of medicine is do no harm. And I would never, I never wanted to take chances with people with something so important. So everything we do, we've tested and validated and found that it's safe and giving people a really positive improvement in their quality of lives. I'd say the hardest things I deal with um, are a couple. One, there are people who do these surgeries who aren't quite as thorough or well trained, and all the time I see people come in who said, "Oh, I just had my facial feminization done a month ago, 2 months ago," and it's not. They didn't get what they deserved. I'll put it to you that way. So that's frustrating, and people are sort of all over the place throwing their sort of trying it out, but it's not something you just try out. And then the other thing that's very important is making sure that people understand what the changes will be and the opportunities they have and what facial feminization does and does not do. So when you have facial feminization, it gives you the opportunity to look much more feminine. But looking feminine requires some effort for anybody. So there's still makeup and behavior and the way you project and the way you speak and act and walk, and all of those things don't necessarily change with surgery, but the changing these fundamental features of the face and the way people perceive you gives you the opportunity to be perceived the way you want.
Right. Um, I can definitely see that. I, for one, am not that great at makeup. So that's been kind of a skill I've been acquiring post FFS. I'm wondering also with that being said, what kind of improvements would you like to see in the field of transgender healthcare, especially like in facial feminization particularly?
Oh, I think what we would really need is more consistency in outcomes. Like I said, I see people who've had it done by people who don't specialize in that. And sometimes it comes out well, and sometimes it really was not in their best interest and was not a good use of their time and resources, and they didn't get what they needed. So some sort of improved training perhaps among surgeons. We do a lot of that here, where we are constantly showing people what we do. We have surgeons come visit, we have surgeons watching our surgeries. I do the surgeries, of course, but we're talking about it and lecturing about it and writing about it and sharing what we know so that people who are other areas or who can't come to Boston will get a good outcome.
Gotcha. Um, I'm looking at my questions here. Something I actually wasn't really prepared for, speaking from my personal experience, was kind of how tense the recovery process was. I'm curious, how do you tend to guide patients through the recovery process? And are there any tips that you have to help them stay positive during this time? I know it can be different for everyone, so I'm curious about that.
Absolutely. So I've been doing these procedures for more than 24 years now, and we've been constantly improving that. So we have emails, links to videos, paperwork, documentation, uh, kind of a big sister mentorship program, all sorts of things where someone who's going to have this procedure or recently had this procedure will know what they can expect on each day, what's normal. And there's a person they can speak with who's been through this. So not just somebody from our office, who maybe they'd say, well, I'm very happy speaking with the coordinator from their office at the Speigel Center, but isn't there someone who's had the surgery I can talk to? We arrange all those kinds of things. And then we make sure, one of the things I tell everybody who comes to see me is, I don't want you sitting at home or in a hotel or at your, you know, apartment you've rented or whatever it is, or with a friend, being nervous, and just contact us. That's what we're here for. If you feel any kind of concern or anxiety or worry or question, call us. We're available 24 hours a day, and you know, reach out, and we're here for you. If it's amazing with telephones and stuff, if you have something like, oh gosh, is this supposed to look like this? You can ping me a picture from anywhere, anytime, right? And then if I can't sort it out, we could go on to a video, and you don't have to, get all dressed up and come into the office. And it's really easy. And I can go, oh yeah, everybody gets that. That stitch is going to dissolve. Don't worry about that. And I think one of the things we really try to do here at the Speigel Center is to make sure that not only you're going to get the best results, but I always tell everyone on our team, I want people to be a little bit sad when it's over because they had such a nice experience. It's sort of like leaving vacation. Now, obviously, that's exaggeration. It's not vacation, but I want people to feel like they felt so heard, cared for, attended to, that it was really pleasant. And so we do everything we can to make sure that's the way it goes.
I love that. I think that's kind of one of the things I see missing in healthcare, especially gender affirming care in particular, is that like human aspect, just like checking up on the people that you're working on. I know whenever I was recovering from my FFS, I had my nurse on speed dial. And so anytime I felt like anything, I'd be like, hey, Christina, like, is this normal? And she'd be like, yeah, it's fine. Like, don't worry. Or if it was something that she thought was worth investigating, she'd be like, just come into the office, we'll check it out, it's gonna be okay. And that was always really soothing for me.
Right.
Uh,
Yeah, that's important. I understand that, well, I see these presentations of how you heal every single day. For most people, it's a brand new and once in a lifetime.
right. I guess in addition to recovery, something that I'm curious about is kind of the emotional side of FFS. When I was recovering, I think spending so much time not 100% alone, but just with my partner and my roommate, not going to work, watching a lot of TV, reading, but feeling a little bit isolated. I didn't really anticipate how much of like kind of inner work I was going to be doing during that time period as well. And so how do you address the emotional side of FFS with your patients, especially those who are dealing with a lot of dysphoria or anxiety around the procedure?
It's a great question. And you had asked me earlier, what's the hardest thing I deal with? And they're related, these two questions.
Mhm.
One of the hardest problems, challenges that I face is sometimes we'll see someone who's had her surgery and looks unbelievable, just like, wow, exceeded. Like, I just want to show everybody. And they're not happy. They're not they don't see it. And I think what happens is they're not seeing this, they're seeing this. They're looking in the mirror and they see the inside of their head. They see their thoughts and their fears, and they see their past. And I will counsel people sometimes if I sense that beforehand or afterwards, if that's starting to happen. I'll counsel them. I'll say, you're going to have to get used to not having the same problems you had. You're going to have to get used to the fact that instead of most people seeing you one way, now most people will see you a different way. And the way people are seeing you now is the way you wanted to be seen, or you want to be seen. And so if someone from your past doesn't comment the right way, or your unpleasant aunt or uncle misgenders you or something, that's not a reflection of the world. And you have to get past that. And I'll tell them that, many women get misgendered at times, and cisgender women who haven't had to face the challenges that a transgender woman had brush them off as that's a you problem, not a me problem. And a transgender woman might take it as a me problem instead of a you problem. And you have to reach that point where you say, no, I look great. This is a you problem, not a me problem. And all those things take time. I tell my clients, my patients, my children, that the hardest thing in the world that we have to face is our own heads, and getting control of our fears and our worries and our goals and our thoughts. And it's a lifetime struggle. And that's one of the hardest things we deal with. But we have resources here. We have the big sisters who can talk with you. We have our videos, our paperwork, and we hopefully let you know that you've got a real resource now. I sometimes tell people, or I think it always is, after you've had procedures with me, your face is your face, but it's a little bit my face. So I have some big investment in your face where I really want you to look fabulous and know that we're getting you where you want to go.
That's awesome. I know we've talked a little about the emotional side now. I kind of want to bring it back to the procedure itself again.
Sure.
With it being such a new, innovative field, I'm wondering, how do you keep up with all of that? And are there any new advancements in terms of the technique of FFS that you're aware of or that excite you, and how do they benefit patients?
That's a good question. Forward progress in medicine, it's sort of like this. Okay, so this middle line here is the straight ahead into the future, but then people start to veer off, or they try things that have been tried and they don't really succeed. So there's a lot of things out there that have mixed benefit. I'll give you an example. Some surgeons are now using these templates where you can get a CAT scan, an X-ray of someone's head, send it off to some engineer, and the engineer will say, well, if I was doing the surgery, I would do this, and they send you back a plastic thing that you put on the person's head, and it's like a cut along the dotted lines thing, and it kind of tells you how to do the surgery. Is this good or bad? I think it's both. The good is it'll allow inexperienced surgeons, maybe in remote places where there's no other option, to help some people, because it's sort of it's a paint by numbers kind of thing. Do this, do that. The bad is you don't get the same results. You don't get the same aesthetic outcome as if you see someone who has done this, 5,000 times. So I would consider that to be a little bit of an offshoot that's going the wrong way. Similarly, and some of this is a little technical, some of the ways that people do jaw shaping is very it's outdated, and people present it as, oh, this is new and exciting, but it's not, because they didn't do the research. So the way I know what's going on is we stay at the forefront of it. First of all, we just do more of it than anyone. Second of all, we're an academic place, so we're constantly evaluating. And third of all, like I told you, I'm always being watched. So everything I do, I have to explain to very smart people. And if they go, why did you do this instead of that? I have to have a reason, and it can't just be, well, that's just what I like to do. I have to really be able to justify why it's better, is going to get a better result, is going to get quicker healing. And then we keep track of publications. So I'm I'm an editor and reviewer for many medical journals. So all the new publications in this field kind of cross my desk before they get released, and I help those authors and physicians kind of fine tune their work and help them go the right direction for the maximum benefit. So another long-winded answer by me, sorry, but basically we just try to keep our pulse on everything, and we're constantly checking our data, reviewing patients. I can't talk about it yet, but we have another great study coming up soon that we were working on starting now, which is going to really revolutionize the way the neck can be feminized. So just, staying involved and active and excited.
Nice. I think I have time for one more question. And this one
Sure.
is for me, actually. I'm just curious, are there any technical differences or differences in how you typically work with people of color? Do you normally see like certain features that people are like looking to change about themselves, like more so in like women of color or people of color?
Yeah,
Does that impact your practice, I guess?
it's a great question. In general, I see people who want to look like the best looking feminine version of who they are. So not want to change everything about themselves or be someone that they're not, or look like they came from a different family or background. So absolutely, there are things you have to consider. And we do all the time. So people of different backgrounds have different features that define masculine and feminine. The skin, the amount of pigment in your skin affects how scars heal. The type of hair you have affects how we're going to do things. The type of cartilage you have affects how we do things. So I know that people of certain ethnicities, some people of Asian background, some people of African background, the cartilage in their nose will be different than people from a different background, maybe South American or Northern European or Russian. And so it's just something I know from having done this so many times, and we know kind of what we're going to encounter, and then how you're going to feminize the structures so that the person I'm seeing looks like a very attractive woman from their family. So it's always on my mind, because again, like I told you, ultimately, this is for you. This is for the person who's coming to see us at the Speigel Center. It's for you. And I can't be happy with what I've done unless you're thrilled. You can't be thrilled unless you get what you want. And so that's what we're always working on, and using all the information we have.
Right. Well, thank you so much for that. I
Of
really
course.
appreciate all of your thorough responses, you sharing your knowledge. Again, if you're watching this and you have any questions, feel free to drop those in the chat right now. We're about to get to the Q&A section. I'm going to pass it over really quickly to Aiden for the next minute before we get into those questions.
Okay.
There we go. Can you hear me? All good?
Yes.
I started talking without unmuting. Such a rookie mistake here on Zoom. Awesome. Well, thank you so much, Dr. Spiegel and Lath. So, as before we get to questions, so again, if you have any questions, please, as Lath said, drop them into the Q&A, or if you can't find the Q&A, just drop them into the chat. And If you feel inspired by today's conversation, we do encourage you to make a donation to Point of Pride. Your support allows us to continue providing free gender-affirming services like binders, gaffs, HRT, and surgery like for people like Laeth. All of the donations can be made. I will drop a link into the chat, but also you can text one word trans futures to 44321. Every contribution makes a difference. So we're going to get to questions now. So Laeth, are you able to, I was thinking if you just pick from the Q&A, I have some questions that are on the back end that have been sent in the beginning during registration as well. But if we get to the Q&A first, if you just start reading one, I will hit the answer live button so people can see that it's being answered and that it's been answered. So is that good for you?
Oh no, I did the thing too.
Yeah,
Yeah,
it
that works
happened.
for me.
Okay, awesome. So I'm going to hand it back to you and then we'll go through these questions and I'll send some more that came through earlier. I'll just send them straight to your chat.
Okay, perfect. So one of the first questions is how would someone go about picking a surgeon? Are there particular things they should look for? How should we differentiate, I guess, in practices? Do you have any thoughts on that?
It's a hard one. You want to make sure that they are a board certified facial plastic surgeon or plastic surgeon. You want to make sure that they are experienced, that you might want to ask them, where did you learn to do this? Who did you train with? Did you learn this by reading reading a magazine article, or did you actually have some experience in this? And then what I always tell people too is you can talk to someone like me. I am the most experienced facial feminization surgeon practicing in the world at this point. And if you say, I need to find someone in my town for some reason, you can always talk to me and I can tell you who there is that I can recommend.
That's awesome that you can serve
We
as
do
a
video,
resource.
like we're on Zoom now, but we can do a video call where I can see an individual and even tell you this is a good idea, what you heard locally, or this is maybe something different than I would personally do.
Yeah, that's so cool that you're able to be a resource like that for people. Here's kind of a specific question. What is your experience with getting hair transplants to cover up something like a widow's peak? Some surgeons discourage getting graft support FFS because they have a tendency to fall out. Do you agree with that? What are your general thoughts?
Okay, it's a great question and it shows a lot of insight from the person who asked it. Here's the answer. First of all, if you're going to get forehead surgery done, then don't do hair grafts until you've had that done. Why? Because I can advance your hairline. And you may be getting hair grafts you don't need, or in places that is not the best focus for your hair grafts. Now, what I do here at our practice, and again, we specialize in this, so we have a system where we can do your forehead surgery and then get the hair grafts in while you're still here. So within a week, and they survive, they last, they grow well, they look great, and they minimize any signs of surgery and will correct things that surgery maybe can't correct. So if you have a very high hairline or very significant recession, then surgery will bring it part of the way, the hair grafts will bring it part of the way, and will get you where you want to go faster.
Wow, that's awesome. That's a quick turnaround.
Yeah, but definitely do the hair grafts last if you can.
Right, right. So we have someone from Pakistan asking, they want to know, do y'all have any programs or assist trans women outside of the US with obtaining gender affirming care and getting their surgeries? They said that from what they've been told, the recommendation is 2 years for HRT.
Okay, so there's two questions in there. So how long should you be on HRT? And what if you're from out of the country? We've seen people from half the countries on earth at this point, including Pakistan, who come for surgery. So that's no problem. You know, you really need to be with us for about a week, which is not that long. And it depends on what you do. If we do something less than comprehensive, it could be even just a couple of days. So some things like Adam's apple surgery or voice surgery that we do, or like lip lift surgery, you can come see us and be back home in 2 days. You may want a longer vacation than that, but certainly we can see you from anywhere. And then the question about HRT is very interesting. So what does HRT do in the face? It's going to do a couple significant things, and there's a few things that it's not going to do. So what it will do is stabilize your hair. Super valuable. So if your hair is walking back every year or month or day, getting your hair stabilized is very helpful. HRT is going to help with that and prevent the hair from falling out further. There are other things we do as an aside for hair, like PRP and certain supplements and other red light treatments and hyperbaric oxygen, other things we do to keep your hair. But HRT is going to help with your hair. HRT can also help somewhat with fat redistribution in the face, and it will sometimes help with the cheeks. But it's not going to get rid of your brow bone. It's not going to elevate your eyebrows. It's not going to enlarge the eyes to give you a bigger eye area. It's not going to make your jaw smaller. It's not going to get rid of an Adam's apple. It's not going to lift your lip. So you don't really need to be on HRT for 2 years before you have facial feminization surgery, as long as you know it's right for you. I have had people in the past who have started HRT after surgery entirely. They say, no, I'm ready for the surgery. I'm going to start my HRT afterwards to stabilize my hair. And that's what they do. And even with something like the cheeks, while it can do some fat redistribution, if you have very flat cheeks, and something like cheek augmentation is going to be very helpful for that, it's unlikely that 2, 3, 4, 5 years of hormones, it's unlikely that those hormones would have ever made enough difference to eliminate the benefits of the cheek implants. So timing of HRT for facial feminization is really, I don't think there's a specific amount of time one must be on it.
That's good to know. I kind of have a follow-up question on that actually. I've heard a lot of different things about PRP, and I was just curious about your opinion about if it's effective, what you've seen so far in its usage for hair loss.
Yeah, so it's an excellent question, Leith. PRP is one of those things that, to me, sounded like, how could that help? Come on. You're going to take out some blood from my arm, spin it around in a centrifuge, and then put it back somewhere else, and that's supposed to grow hair? Who would have even thought of such a ridiculous thing? So, again, being a professor and wanting to do everything scientifically, we did our study, and we reviewed all the literature on this. We published it, gosh, at least a year ago now, maybe 2 years. It seems to work. PRP put into the scalp seems to regrow hair, protect hair, stabilize hair. It's I don't think anyone could really tell you honestly they understand why, but it is safe and effective.
That's good to know because I've done a few experiments.
Yeah, it's really nice. It's easy. It's just an easy one.
Yeah. So someone's asking, what are there things that patients can do to speed up the recovery process?
It's a great question. Yes. There are things that the person having surgery can do, and more so there are things that the surgeon can do. So it's a combination. I want everyone to be back to life looking good as fast as possible. So we have this enhanced recovery experience we do, where we involve red light lasers, we involved hyperbaric oxygen therapy. We have a tank here in our office, and you can go in that before and after surgery, and that speeds up healing, reduces swelling, reduces bruising. There are certain types of supplements we'll recommend that you take, and others we recommend that you don't take to do that. And then one of the most important things to speed up recovery is seeing someone who does this all the time. And for example, hairline advancement, eyebrow elevation, adjusting your forehead and opening up your eyes will take, in my office, 90 minutes, between an hour and 15 minutes and an hour and a half, every time, year after year after year. It's because we do a lot of this. If your surgery takes 90 minutes, it will be less traumatic, less bruising, less swelling, and a better result, because as you go, your tissues are swelling and changing, and it becomes harder for your surgeon to put them back. Now, there's someone who came to see us here recently about a procedure who said that she had this forehead surgery done elsewhere, and it was 10 hours. And like, wow, 10 hours? You're going to have a much slower recovery and not get the same outcomes simply because it's taking too long. So there are things that we do in surgery by being efficient and experienced and knowing how to do exactly what's right without causing extra inflammation. And all those things really help get people looking good as fast as possible. And like I told you earlier, I want everyone to have a great experience here, to really like their time here. So making sure that they're healing quickly is part of that.
Nice. I'm gonna kind of combine questions here from
Sure.
the chat and that were on the back end. In terms of insurance, do you in particularly, I guess, accept Medicaid, and do you see insurance coverage for FFS getting increasingly more difficult in the coming years, particularly in terms of Medicaid and Medicare recipients?
So I'm by no means an insurance expert. I
Right.
really focus on the surgery part, and we have
Yeah.
people here at our office who can answer questions about each person's situation. We bend over backwards to work with everybody's insurance, but some insurance carriers want you to go to someone who's kind of part of their group, who's less experienced, and a little bit that's a way of dissuading people, perhaps. I don't know, but we do try very hard to help this be accessible to everyone, and we provide whatever resources we can to facilitate it.
That's awesome. Um, let's see here. So we have someone who is a cancer survivor, and they say they were diagnosed non-Hodgkin's.
Non-Hodgkin's
Probably butchered
lymphoma.
that. Non-Hodgkin's lymphoma in 2022, which first of all, whoever that is, thank you so much for sharing that. They're wondering if they can get FFS, if it's safe in the next year or two. What are your thoughts on that?
Well, if you're in remission and your hematologist or oncologist tells you that you're fine for surgery, you can have it. There's no reason specifically to think that that would be a problem. It's going to be all about the individual. And that's another thing that we try to do here is I always work with each person's healthcare team to make sure that we don't have any surprises. We want to make sure that your experience with us is going to be smooth and almost boring. Surgery in, surgery out. I feel fine. What's on TV? And so something like that, we would be working with your doctor to get the timing and experience right for a speedy and good result. But I don't see any reason why you couldn't have surgery anytime, as long as your doctor feels you're fine.
That's good to hear. Yeah, that's awesome. I have another question. Here we go. So this person is asking about being put under for the procedure. They're wanting to know specifically, are there any BMI requirements in order to be put to sleep? Are there anti-anxiety meds that can be prescribed before surgery to help kind of prepare with anxiety of going into it?
Oh, sure. The answer is yes on both. Your BMI will not prevent you from having surgery if you're very heavy or very thin, but it would just change potentially where where we do the surgery. So if you are at a very high BMI, we might do it at one of our surgery locations versus the other. And but we'll get it done. That's fine. And then as far as anxiety, absolutely. We will help you with that. We'll make sure that, first of all, you might be pleasantly surprised that by the time you're done talking with everyone here at the team, you feel enthusiastic and have much less anxiety. But then if you need something to relax, of course, we do that pretty routinely to help people. That's no problem.
Awesome. That's definitely helpful, working with a team who kind of like makes you feel comfortable and helps soothe some of those anxieties ahead of time before going under. I think we have time for one more question. Morgan is asking, how much time do you need between getting another surgery before getting FFS? For instance, if someone just had a breast augmentation or bottom surgery, how much time do you recommend them taking before they undergo FFS?
Great question. So if you're otherwise healthy and you had, say, breast augmentation, we could do your surgery a couple of weeks later, a few weeks later, a month later. It's fine, as long as your health is good and you're okay. And we do that pretty regularly. With bottom surgery, the same. As long as you feel like you're healed well and your surgeon who you worked with is happy with your progress and says, yeah, you're fine, then by all means. And then putting it the other way, you can do facial surgery with us and then have, well, breast augmentation we often do simultaneously. So people will come in and do their face and breasts simultaneously, which is nice because it's efficient and you have one recovery period and only one time that you have to take off from work or, budget the time to be down. So we'll do that routinely. But then most of the time after our surgeries, you could go have one of these other surgeries like bottom surgery again, maybe a month later, is no problem. The only one that we do where we ask for a longer time period is voice surgery. When we do the voice surgery, I try to ask people not to have a surgery where they're going to have a tube in their throat for about 6 months, because you don't want anything to disrupt the healing there so that you'll get the best outcome. So that's the one thing to factor in. And people will sometimes see us and say, I'd like to get voice surgery, in December, and then in January I want the facial feminization. And I'll say, well, let's switch those if you don't mind.
Right. Well, that's also good to know. Yeah, well, thank you so much for answering all those questions and
Oh, it's
offering
my
all.
pleasure. It
Yeah,
was speaking with you and with Aiden, and our interpreters here were fabulous. And it was great questions. And I hope I was able to answer some of the questions you have. And if we missed some, you can always reach to us at our Dr. Speigel website and send in a question, and someone will get right back to you, because we want people to get as much information as they can.
perfect. Well, with that being said, I will pass it back off to Aiden.
Awesome. Yes, thank you so much, Dr. Speigel. I did put your information in the chat.
Okay.
And also, Lei, thanks so much for hosting this event. Thank you to everyone who asked questions, and thank you for your attendance today. If you want to stay connected with Dr. Speigel, like I said, information is in the chat. We'll also have this event on replay on our blog, which will also include Dr. Spiegel's information and all resources that were mentioned here today. I do encourage you all to stay connected with Point of Pride by following us on social media at Point of Pride ORG, and subscribe to our newsletter to get information about all of our programs and when they open for applications. Remember, if you would like to support our work, donations can be made by texting the word Trans Futures to 44321. This is officially the last day of Trans Awareness Week. Tomorrow is Trans Day of Remembrance. So let's spend this last day celebrating with all of our community so that tomorrow we can have some moments of remembrance for those who have passed and really think about our future as we go into 2025. Thank you both for being here. Thank you, interpreters, for coming for those who needed it. And I hope you all have a great rest of your day.